Hi, I'm Dr. Ron Miller of Pursuit Physiotherapy, and today I'm going to show you the key to resolving your neck pain. And the first step here is not all neck pain is the same. You have to understand what type of neck pain do you currently have. So, for example, a lot of times people can have a certain type of neck pain that's in the upper cervical spine, and like a lot of times they'll report that they have a headache across the back of their skull, or even you could have neck pain that has a headache that comes around the side of the head and even behind the eye. We like to call that a cervicogenic headache, meaning it's a headache but the root cause is coming from the cervical spine or the neck. You can also have a pinched nerve. A lot of people will say they did a certain exercise or activity, or they slept on their neck wrong, and every time they turn their head, it's like stuck, and it causes their pain on that same side wherever they're trying to turn their head. You can have a herniated disc a lot of times. If it's a minor one, maybe reading, looking on your cell phone, driving causes your neck pain, or a flexion activity is making your neck pain worse. If the herniation is big enough, you can even have shoulder blade or even arm pain, which we call this radiating pain, meaning that the herniation is big enough that it's pinching on a nerve root and it's shooting pain or referred pain into the shoulder blade region or even going into the lateral arm. But the root cause is here, even though you feel arm pain. There's other cases where patients will just complain about this upper trap tightness, where they feel that their neck is always tight and their upper trap muscles are always tight too. So the last type of pain is kind of like a general neck stiffness or tightness, but the tightness is always chronically there no matter what happens, and normally it's involving the upper trap muscle. So those are the major types of neck pain, and the goal of understanding this is most of these symptoms are just the effect. It's not the cause. So if you just chase the effect, a perfect example is with that upper trap tightness. If you massage your upper trap every time, your upper trap tightness will always come back. There's underlying problems or risk factors that are causing the tightness, and you don't treat the effect, you have to treat the cause. So what are some risk factors that may be predisposing you to have neck pain? So the most common one and the simplest one is a prior history of neck pain. If you were in a motor vehicle accident, or if you fell at some point, or you had a prior history of neck pain in the past that wasn't treated properly, these are all risk factors that may predispose you to having neck pain. It doesn't mean you're always going to have neck pain. It's just a risk factor or something there that's present that may predispose you to having your current symptoms. Another common one is posture. We live in a seated society where we're constantly sitting, we're on the computer, we're reading, we're looking on our cell phones. So the postures that our habits are putting us into may predispose you to having neck pain. So I could treat a secretary who has horrible workplace ergonomics as much as I want, but until I change the workplace, she's always going to have neck pain. So understanding posture or identifying some postures that is predisposing you to have neck pain is another example of what we have to resolve in order to get you pain-free and make sure that your pain doesn't resolve or return again. Another one is range of motion or even strength. A perfect example of this is if you can only turn your head to 45 degrees, but every time you have to back your car out, you need 70 degrees of neck rotation. No matter what you do, every time you try to push your neck beyond your threshold or beyond your range of motion, you're going to get some neck pain from that. So you're not going to be able to turn your head that far until you address that range of motion problem or that strength problem that's underlying or causing your neck pain. So do you need imaging for your neck pain? Research has shown us that you can take 10 people who have neck pain, put them in an MRI, put them in an X-ray, and they'll have all sorts of positive findings. They'll have herniations, they'll have arthritis, they'll have facet joint problems, but you can take 10 people who don't have neck pain, put them in the same scanners, and they have those same positive findings. So that means that just because you've been diagnosed with a herniated disc doesn't mean that that's always the root cause or that is causing your pain. So the key thing is, can you take those image findings and match it with how you present physically in the clinic and see if it matches, because there's plenty of times that people will have positive findings on an image or an MRI, but it doesn't reproduce their pain in the clinic. So in most cases, you don't need the actual imaging done. You don't need to waste the time or the money on it. And a thorough evaluation can be able to tell you whether you do have any kind of present impairments that need imaging or warrant the imaging. So most cases don't need imaging unless it's a severe case of neck pain. So what is the key to resolving your neck pain? So the first step is going to be to clearly identify what type of neck pain you have. And two, the goal is to solve the root cause that is causing your symptoms. Stop chasing pain, stop chasing the effect, and solve the cause. And a perfect example is if there's a fire going on in your house and you just run up and shut off the fire alarm, but the fire's still going and the house is still burning. If you're having neck pain, it's kind of like your fire alarm and it's telling you that something's wrong. You just don't want to cover up the pain with some pain meds or block pain with an injection. You want to solve the root cause of it so you prevent the pain from coming back and make sure it goes away. So the first step is to solve what type of neck pain that you have. And you can click on the tab below and click on what type of neck pain you actually have. And it's going to take you to a page and educate you and find out what is the best way to treat it. So thanks for tuning in, and I'll talk to you soon.